Hi everyone, I'm Celso de Costa and I welcome you to our GBT as a Practice Builder episode. First question that we need to ask ourselves is, what is the importance of the oral hygiene team? To help to fulfill the purpose of your practice, this means restoring and maintaining a patient's oral health and function, provide a constant source of potential treatment to the dentists and specialists, and of course, if done well, it will be a steady revenue source and a profit center. We can say that the oral hygiene is a key performance indicator, a KPI, for the dental practice quality. We already know the difference between the old methods and GBT, and how invasive the old methods are. So, should we keep doing the same technique of the last 50 years? If no, what do we need for a modern prophylaxis? I can say that we need 4 things. Good results, a good patient experience, minimal invasiveness, and of course to be profitable. GBT can answer all the 4 aspects. You can build a new interdisciplinary protocol like pedodontistry, ortho, perio, or even implants maintenance. But how will it improve the practice? With GBT, the patient is part of the treatment and we deliver personalized care. This will keep the patient in the practice. And study cases show 85% of the patients that got GBT, they fix a second appointment and they do not miss this second appointment. So GBT can provide a shorter treatment time also that be used for a better communication, to bundle other treatments like bleaching, digital scanners, or just to have a better patient flow rate. It increases also the profit as it decreases downtime in your practice. In a case study of 24 clinics, we saw that the downtime, this means the time that you are not working in the chair, went from 15.4% before GBT to only 3.8% after starting using GBT. Even further, in our study case, we found that the ratio 1 dentist to 1 dental hygienist, 30% of the direct revenue was coming from the dental hygiene department. And stats show that 64% of all dental treatments done by the generalists and specialists were provided by the dental hygiene department. Another benchmark is the number of patients that you have in your periodontal program. The benchmark says that we need to have 25 to 35% of your patients in the periodontal program. In the same study case with 24 clinics, we noticed that before implementing GBT, we had only 16% of the patient in the periodontal program. Too low, right? So this means that we weren't doing our job correctly and having underdiagnosed periodontal disease in our patients. So after implementing GBT and with the first step being the assessment, so we do the perio probing, we started to look for the periodontal disease, to find it and consequently to treat it. So in 2 years, this study case of 24 clinics went from 16% to 29% of the patients that accepted and were following a periodontal treatment program. Finally, we were doing our job and treating our patients as we always should have. When we focus on a continuous model care that is geared towards our patients' health, needs, and a good experience, we are now also building a tribe of patients that are loyal to us regardless of health funds and competition. GBT makes the patient stay, so better patient flow, less unfilled hours, less cancellations. They will refer patients, so they love it, they want to advocate for you, they will accept the treatment plans and periodontal programs, and of course the patients will be healthy, and a healthy patient is a happy patient. So they know that you really care about them and you implement GBT because it's easy, innovative and profitable. We have more than 12,000 dental practice certified as GBT practice worldwide. So GBT is not the future anymore, it's the present. Thank you a lot for being able to see today's episode and don't miss the other ones.